Shut up and sit down.
10 lines on coronavirus for kids, children, school students, and competitive exams in English. 1. Coronavirus are a large family of viruses that are known to cause illnesses ranging from the common cold to more severe disease such as Middle East respiratory syndrome, MERS, and severe acute respiratory syndrome, SARS. 2. A novel coronavirus (CoV) is a new strain of coronavirus that has not been previously identified in humans. 3. Detailed investigation found that SARS-CoV was transmitted from civet cats to humans in China in 2002 and MERS coronavirus from dromedary camels to humans in Saudi Arabia in 2011. Several known coronaviruses are circulating in animals that have not yet infected humans. As surveillance improves around the world, more coronaviruses are likely to be identified. 4. It depends on the virus, but common signs include respiratory syndrome, fever, cough, shortness of breath, and breathing difficulties. In more severe cases, an infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. 5. Some coronaviruses can be transmitted from person to person, usually after close contact with an infected patient, for example, in a household, workplace, or healthcare center. 6. When a disease is new, there is no vaccine until one is developed. It can take several years for a new vaccine to be developed. 7. There is no specific treatment for disease caused by a novel coronavirus. However, many of the symptoms can be treated and therefore treatment based on patient's clinical condition. Moreover, supportive care for infected persons can be highly effective. 8. Standard recommendations to reduce exposure to and transmission of a range of illness include maintaining basic hand and respiratory hygiene and safe food practices and avoiding close contact when possible with anyone showing symptoms of respiratory illness such as coughing and sneezing. 9. Health workers can be at risk from a novel coronavirus as healthcare workers come in contact with patients more often than the general public. WHO recommends that healthcare workers constantly apply appropriate. 10. WHO encourages all countries to enhance their surveillance for severe acute respiratory infection (SARI) to carefully review any unusual patterns of SARI or pneumonia cases and to notify WHO of any suspected and confirmed cases of infection with the novel coronavirus. Countries are encouraged to continue strengthening their preparedness for health emergencies in line with the International Health Regulation 2005.